Hi, I'm Andrea Henderson, and I started having pain in my hip probably about 2 years ago. And at first, it was just a little annoying. It got increasingly worse. It was really starting to affect how I was moving, and that was not acceptable for me. I was newly retired, and I really wanted to be able to enjoy my retirement and do all of the things like traveling and being active like retired people are supposed to be. I also started having some pain in my knee when I was trying to get up from a deeply seated position. And if I was in a car for a long time on a trip, I would have issues with both my hip and my knee. And I knew that I wanted to have a better quality of life than I was currently having. I really started to see a change in my activity level. It was getting so much more difficult for me to walk and to be mobile that I kind of avoided it. I knew that because I was retired, I needed to be more active, but I found that my hip pain and the accompanying knee pain really made that a lot more difficult. So I did not want to become increasingly worse, and I knew that I needed to do something about having this hip pain because it was really starting to affect my daily life. It was difficult for me to do simple things like go to the grocery store because I was having a lot of pain and issues with that. There is such a huge improvement in so many areas right now. It's so much easier for me to move. I can go to the grocery store with no problem. I can climb stairs with no problem. I can bend and stoop. Just getting the pots and pans out of the cabinet when I'm cooking without it being an issue. Car trips are not a problem. I can sit for longer periods of time without it being so painful. And in every area of my life, I have noticed that there is just a big improvement. I was very intimidated by the gym when I first started. I went into the gym and there were all these machines and everyone knew what they were doing, and I was completely lost and intimidated. However, now that I have a specific routine, I know what to do. I'm no longer embarrassed to ask for help. There was a time that I've always been kind of an overachiever and I like to do things myself, and I would not ask for help. But now it's just a regular thing. Prior to coming to Injury to Victory, I had gone to an orthopedic surgeon. He x-rayed my joints, saw that I had hip impingement, and I was prescribed physical therapy for about 5 weeks. And I did see some improvement, but I was only able to go for about 5 weeks. And after that, I tried to keep up with the exercises, but there was not much room for me to grow in that. To combat the pain, I started taking a leave when I had pain in my joints, mostly my hip and my knee. And I really don't like to take medication unless it's highly necessary, but it had become important for me to use that because I was having a lot of pain. And although I had had the physical therapy before, I did not know what I needed to do to go past the point that I had in the 5 weeks that I had been going through the physical therapy. I was a bit hesitant to go into Injury to Victory because I had never had an experience with a one-on-one coach. I had been to physical therapy. It was one-on-one, but not really. There were a lot of clients there. There was a lot of activity. There were a lot of people. And being in that setting in itself was a bit intimidating. I also feel that I was a little bit nervous because I didn't want to fail. I like to be successful, and I was not secure enough to think that I was going to be able to do what it took to move past my level of fitness and to make improvements with my hip and my knee. It's a holistic approach. So it deals not only with the physical getting stronger, but it also focuses on nutrition, hydration, and sleep. When I had gone to physical therapy before, the exercises were somewhat tailored to me. But with Injury to Victory, I go through my routine, and as I start to improve, changes are made so that I'm constantly moving forward. Also, discussion of my eating and how that is going to affect inflammation. And I didn't realize that those were connected. Trying to improve my sleep hygiene and also my hydration. All of those areas are something that I have never seen with anything before. I had had a gym membership for a long time, but honestly, I had not gone because it was intimidating. However, being coached step by step and being told how to do the correct movements and being able to self-correct myself has really made a difference in my confidence in the gym. But I will say that having tailored activities that are made especially for me, being able to go into the gym, being able to look at the app and being able to look at the video. There's a video for each activity or exercise. If I've forgotten how I'm supposed to do that, that is a huge help in helping me to become more confident to complete my workout routine. I think the best part of my health journey is the feedback that I receive weekly, and not just weekly because the app is ongoing. If I have a question about something or there's something going on, I can message through the app to Injury to Victory. I think too, when you're new to fitness, having individual activities that are tailored for you and feedback is so important, because when you're trying to do a new exercise and things might feel a little bit uncomfortable, and I don't want to use pain because it's not pain, it's a little bit uncomfortable, but you can't grow without some discomfort. And I always know that if I'm feeling discomfort, that's to be expected because I'm moving and I'm making progress. However, I'm always told that if I'm experiencing the discomfort after 48 hours, I need to make sure that I message and let my therapist know so that we can see if there is something going on. But having that feedback and being able to have a back and forth question and answer with Injury to Victory has made a huge, huge difference. And I think that that's probably the best part of it. Being able to have individual feedback and also to be able to have my questions answered when I need to have them answered. Without reservation, I would recommend this approach to anyone who has issues with joint pain, knee pain, et cetera, because it's not just looking at the pain. It's about making you stronger as an individual. It's about teaching you how to push past fear or discomfort with yourself so that you can be the best person that you can be. And I feel that the things that I have learned with this approach with Injury to Victory are not only helping me to become stronger physically, but also emotionally and spiritually, because the more you feel better about your whole self, the more you're able to be a better person in general to everyone. So I would recommend this approach without reservation.